All right, this video is going to be a real quick and dirty, concise review of the brachial plexus. What we've got here is a preparation where the axillary artery has been removed. Here is an axillary artery. And where would it go? It would sit right here, right? So it would define the chords. The position of the chords are defined by their relationship to the artery. So which chord is this, gang?
Lateral.
Lateral chord, which would make this medial chord, and then behind the axillary artery would be what chord?
Posterior.
What is the main terminal branch of the posterior chord?
Radial nerve.
The big honking radial nerve. All right, so why don't I start at the beginning? Robert Taylor drinks cold beer. So let's start at the roots. So here we have the roots. Do you see that, Anthony?
Yep.
And you remember when we did our drawing in class? We have a Y here. This comes out and makes a Y this way. And then here's another Y right here. So what root is this?
C5.
So we got C5, C6, C7. What's this one?
C8.
C8, and what's the last one?
T1.
T1, right? So it's 5, 6, 7, 8, T1. Those are the roots. Now, do we have any nerves coming off of the roots?
Yes.
Can you name the one here that's it's broken, but it'd be a little guy coming off up here? I think it pierces the scalenus medius. Does anybody know the name?
Dorsal scapular.
Yeah, what muscles are innervated by the dorsal scapular, by the way?
Levitating scapulae.
Rhomboids and levator scapulae. Very good. All right, now what other nerve may come off the roots? Does come off? Long thoracic. And what is that? 5, 6, 7-ish kind of, right? And lo and behold, look at if we tug here. Anthony, can you see that? Can you see the end of it here?
Yes.
You're not zooming in too tight, are you?
Never.
And you have the lens cap off? Excellent. Here
No, I
we
didn't.
actually see the long thoracic nerve. Its attachment to 5 and 6 is torn, but we can see it to 7 here, right? So it'd be coming off these roots, going down to innervate what muscle?
Serratus anterior.
What the heck is the artery that goes with this nerve?
Lateral.
Lateral thoracic. A for artery, long, N for nerve. And clinically, what do you get when you cut this nerve?
Wings.
You get very angelic, right? You get a little wing scapula. Your scapula pops out. So that's the long thoracic. So that is the roots, right? So now we're going to go to the trunks. We have upper, middle, and lower trunks, right? Robert Taylor drinks cold beer. Taylor. So this short area is a trunk. Do we all agree?
Yes.
Are we all happy? All right. There's two nerves off the trunk. Can you name this one? And this is real obvious, and when you take the practical, look for the suprascapular nerve, it takes it to the upper trunk. So if we tag the upper trunk, you'll know it's the upper trunk because you'll see suprascapular nerve. And where the hell does suprascapular nerve go here? Anthony, can you see, or do I need to angle it up? Can you see where my forcep is going through, Anthony?
Yes.
What is the tunnel that I'm going through here?
Scapular notch.
Yes, it's defined by the superior transverse scapular ligament, which is right, has a string on it and was tagged last year. So this, do you see that tag right there, Anthony? Is that clear, or do I need to move?
That's
Right
clear.
here, right here. So we tag the ligament right here. So it's Army over Navy. Army goes over the bridge, Navy goes under the bridge, and here's the Navy going under the bridge. Can you name me the two muscles innervated by the suprascapular nerve?
Infraspinatus and supraspinatus.
Infraspinatus and supraspinatus is correct. Now, what artery would be going over? Now, the artery is removed because most of the arteries have been cut out here, but what artery would be going over? Suprascapular artery would be going over the notch. One more nerve off a trunk, which is missing here, but anybody know?
Nerve subclavius.
Oh, that all-important nerve to subclavius that we see in 1 out of 30 cadavers, going to the little muscle fibers you might find under the clavicle. Nerve to subclavius. Okay, Robert Taylor drinks. Divisions. All right, see all this kind of squiggly wiggly stuff here? Those are the divisions. And actually, in the spirit of Adaleke, You can kind of see this X here, right? So we have anterior and posterior divisions. Do we have any nerves coming off the divisions?
No.
No, so we basically ignore the divisions. In terms of the practical, we rarely tag a division because they're like spaghetti and they're messed up most of the time. So we really don't. Can I promise you no division? No, because there are evil anatomists, but typically I don't think we've tagged one ever. So it's Robert, Taylor, Drinks. Now we're to the chords, the big old chords, right? So how do we define these chords? Let's get things. I look for the M. Here's the M. Nice Helvetica M right there. You see it. It's a good font. Or W, depending on how you look. And so we can see the lateral chord, the medial chord, and the posterior chord. Let's take the lateral chord first. What is the big terminal branch of the lateral chord? Musculocutaneous. And normally, this one's going a little low, where it might have been pulled, but normally it pierces what muscle first? What was that? Coracobrachialis. Coracoid process to the brachium, right? Can you name me two other muscles that originate from the coracoid process?
Short-headed.
Yeah.
Short-headed biceps is one, ding, 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 and one more.
Pectoral minor.
Pec minor is the other one there. So it's coracobrachialis, pec minor, and short-headed biceps. That's musculocutaneous. After it leaves coracobrachialis, who's it going to do? Who's your mama? It's going to do biceps and the muscle under the biceps? Brachialis. That's musculocutaneous. What is the terminal branch of musculocutaneous as it peeks out from under the bicep for 50 points?
Lateral antebrachial.
Oh, man. Smoking. What vein does that go in? No, normally we would never ask that, but it's kind of an obvious thing. Cephalic. It kind of goes with the cephalic down here. Lateral antebrachial cutaneous. Cool. We missed something else off the lateral cord. What did we miss?
Lateral pectoral nerve.
Lateral pectoral nerve, which is wanting here. It's missing. What is it going to innervate?
Pec major.
If it was here, it would go to pec major. Would it come off medial or lateral to pec minor? If this was pec minor, would the nerve be here, A, or here, B? A. It comes off medial, named for the lateral cord that it comes off of. Very good. So we covered everything? I think we did on the lateral cord, right? Very good. All right, let's go to the medial cord. What is the terminal branch off the medial cord right here? Ulnar is correct. Name me a spot where we can really smash the ulnar nerve up.
The surgical neck of the femur. I mean, that's axillary.
Well, where would be the most common place? You're holding it right there. The funny bone, the olecranon, right? What is it important for when you talk about the hand? Is it important in the hand?
Yes.
Yes, it is. All the muscles except 1/2 loaf are done by the ulnar nerve, correct? How would you know if you had an ulnar nerve? If I cut this ulnar nerve here, show me your hand.
Claw hand.
Well, a high injury would be that total clumpy claw. A lower injury would be this claw right here, right? The ulnar claw. Klumpy the monkey hung from a tree. If you fall out of a tree and grab a limb, you put stress on these lower roots or lower trunk, and you'll get a total claw. You'll get clumpy. What do we call it when you damage the upper roots or trunk?
Herb Duchenne.
Herb Duchenne. Can you demonstrate an Herb Duchenne lesion, either one of you?
Like that.
Can you see that there, Anthony? She wants it there. Very good. All right, so we're back here, Anthony, to the lateral cord. We have mainly 3 structures coming off the lateral cord. Maybe this is actually one of them. Who knows? What is this one? Let's talk pec. What would you call it?
Medial pectoral.
Medial pectoral. Pierces what muscle?
Pec major, minor.
Pec minor first and innervates it and goes to pec major. Then you have two other cutaneous ones here. What do you call the bigger one? I hope I'm right. The medial antebrachial cutaneous, isn't it? It's usually the bigger one, and the smaller one is the medial brachial. If you had a nerve coming out between the ribs and joining over to the medial brachial cutaneous or medial antebrachial cutaneous, mainly the medial brachial cutaneous, what would it be called?
Intercostal.
Intercostal brachial goes from the intercostal space to join up with the cutaneous nerves of the arm like that. Neato. Okay, so what else? All right, that takes care. Do we get everything on the lateral cord? Do we agree? We got medial pec, we got the two cutaneous nerves, and we got the ulnar. That takes us to the posterior cord, the mysterious posterior cord. What is the terminal branch of the posterior cord again? Radial, the huge radial. Does it innervate preaxial or postaxial muscles? It's kind of an embryological question. Did you guys get into that? Preaxial, postaxial? Postaxial muscles are extensors. Preaxials are always flexors. It has to do with the rotation of the limbs. You know, your lower limb rotates differently than your upper limb. So in the upper limb, the flexors are anterior. In the lower limb, the flexors are posterior. But in terms of preaxial and postaxial, it stays the same. Extensors are always postaxial. So the radial is a big postaxial nerve doing the triceps and coneus, extensors of the wrist. Very good. What is this big nerve here diving through a hole, a square hole?
Axillary.
That is the axillary nerve right there. And we can actually do the magic trick as it comes through the quadrangular space. What artery went with it? It has been removed, it has been cut. I think the stump is here somewhere.
Posterior humeral.
Posterior humeral circumflex was going through the quadrangular space. What hole did we see the radial through?
Oh, the triangular.
Lower
Interval.
triangular space, accompanied by what? Or triangular interval, accompanied by what artery?
Brachial.
Deep brachial, or profunda brachial. Okay. Continuing on the posterior cord, what two muscles are done by the axillary nerve?
Don't. Teres minor.
Teres minor. All right, now we got to look at the posterior cord, and let's have some fun with it here. Let's see. We know these two. We'll put these two together. There's an extra nerve here. It's got a machete on it. Anyway, we got three subscapulars. We've got an upper, middle, and lower subscapular. Do you see those three there, Anthony?
Yes.
What's the modern name for the middle subscapular? And here it was tagged last year. What muscle does it innervate?
Lat.
Latissimus dorsi. What artery goes with it?
Thoracodorsal.
What is the thoracodorsal branch of?
Subclavius.
Subscapular. You're so close. Upper, middle, lower. What is the upper subscapular innervate?
Subscapularis. Half of it.
What's the name of this nerve?
Lower subscapularis.
Lower subscapular. You can actually see it kind of loop around. Do you see any of this here, Anthony?
Mm-hmm.
It's looping around to do two muscles. What two muscles is it
Subscapularis.
doing? Subscapularis and teres major. So that's the upper, middle, and lower subscapular. Upper, thoracodorsal, and lower subscapular. And I think, anybody have any questions? I think we basically covered everything in the brachial plexus that we need you to know. Very good. Thank you very much. One last question before I let you go. What the heck is that? What artery is that?
Brachial.
She goes for the brachial. Anybody have another guess? What artery is that, sir?
Looks like a tendon.
It looks like a tendon. You're questioning the anatomy instructor? What tendon is it?
One end of the
That is
biceps.
correct. It's tendon of the long end of the biceps.